Hey everyone, Danielle here from the Obstacle Doc, and today we are talking about lines of force, specifically how to bias your quad versus your glute in a squat or hinge mechanism. And we are going to use the step-up test to qualitatively show and visually appreciate that motion. So Christopher's going to step up, and I'm going to use this as our kind of driving line of force. So when we think about biasing the quad versus biasing the glutes or our hip extensors, what we want to think about is where our angles are changing more or less. So our quads are knee extensors. They do this motion. And our hip flexors, obviously our glutes, they help extend our hips. So if we're sitting back, they're helping us pull forward. And if we're sitting down, our quads are helping us stand up. So we're going to start with two legs to demonstrate this. When I have this pull, this is going to be our kind of driving center line of force. So if Christopher wants to bias his quads, he's going to create a bigger change in his flexion angle here. So squat down, keep your chest upright. And this is going to, if you can draw a line from here to here, this is a bigger force change than through the center, right? The center stays nice and upright. So when he goes to stand back up, he really has to drive through the knee to extend back. So do that again, right? So this stays really pretty close to the center, but that's what's moving further away. Awesome. Now, if we want to bias the hip extensors or our glutes, he is going to keep his knee over top of his heel or ankle, but when he sits back, he's going to increase the flexion change here. So if I kind of drew this line, you see that he creates more of a change there, and that way when he has to come up, he's using the backside of the hips to extend upright. So if we go into a single leg version of this, so pretend like we're going up a stair, a single leg squat. This is our single leg step up test. If we go with our right leg off the box, so this is going to be biasing our quad because he's staying nice and upright. We're letting the knee do most of the work to drive into extension on the way up. Okay, do that one more time. And again, you should be feeling that through here if you're staying really tall. And then if we want to bias the glute, this is going to stay in line, but now he is going to pitch forward. So we have to drive up through the glute to feel the extension from the hip coming up as he straightens up through his back. All right, so clinical implications for this biasing. First is for anterior knee pain. So anyone who has specifically pain with squats or pain going up and down the stairs, we want to think about the forces that are being pushed through the front of the kneecap. So using this pitch forward to bias the glute instead of just sitting straight down and pushing through that knee extension, that can be really helpful there. Additionally, for our runners, if you are using step up or lunges to strength train and cross train, we want to think about this pitch for our forward propulsion. So we can kind of bias again, using that forward motion from the glutes, from the chest to change the way that we are using our quad or counterbalancing our quad. And then the last thing to think about is if you do have any ankle stiffness, tightness, restriction through the calf, it might be difficult to bias one or another just because of any limitation that can trickle up into the knee in and of itself.